Hello, this is Dr. Oshiemi, Medical Director of Fantastic Wellness Center and Hyperbaric Center. Today we're going to be talking about post-COVID syndrome and the use of hyperbaric oxygen to treat these symptoms. Today we have Brooke with us. She's one of our clients. She and I will discuss what she went through and what we did for her. So post-COVID syndrome is a syndrome of different symptoms or several symptoms that people have after COVID infection. Most people are told, you'll be okay, you'll get over it, and they are ignored and they go on for months and months feeling sad, feeling depressed, feeling anxious. And some of those symptoms include headache, fatigue, brain fog, palpitation, shortness of breath. The list goes on and on. So you don't have to have all the symptoms. You may have one or multiple of those symptoms. So today we're going to hear from Brooke. She will tell us what she went through and how we get to meet and where she is today.
Yeah, so I had COVID end of January of this year, and I suffered with it for about 6 weeks. Every day I was battling constant migraines, extreme fatigue. I had jaw pain. I had shortness of breath. I went to the hospital. I was talking to all types of doctors that prescribed me tons of medication, which I took and made me worse or just not better at all. And I finally met a doctor who put me in the direction of you. And previously I never heard of hyperbaric chambers. And I just thought, at this point, why not give it a try? Couldn't hurt me.
Okay, thank you, Brooke, for that information. I just want to kind of touch upon what you were feeling when you were going from doctors to doctors and they were prescribing you different things. And I mean, it must have been very difficult thinking, do they believe I had these symptoms? Or, I mean, what were you feeling during that time?
Yeah, it was exhausting. I mean, physically, I was in so much pain. And physically being in pain for that long, it affects you emotionally and mentally. So I was just so drained, and seeing all these doctors and not being able to get an answer or help or feeling any better, it was really hard to go through.
Now, were you in school during this period or were you working? What were you doing prior to the COVID?
I was working part-time. I was in school full-time on campus, and I had to drop college, and I had to take a 2-month break from work. So I was unable to do anything. I was behind all my work.
That must have been very difficult for you.
Yeah, very. Yeah, my whole social life just went on pause. You know, being young and all, it was really hard.
And this happens to a lot of people. And this, people basically, their life stops. I know people who are firefighters who can't get back to work anymore. I have this has led to breakup of relationship, have led to stress, anxiety. So it's really, we've seen it a lot. And I'm glad you can share your experience with us today. Brooke, you mentioned someone referred you to us. Could you tell us more about that?
Yes. So at one point of my long COVID journey, I had to go to the hospital, and I met a hospital official while I was there, who directed me to a lovely woman named Tina, who had also gone through the same long COVID journey, and introduced me to you.
Oh,
Here,
yes, I do know Tina. Tina was actually one of our earliest patients that we treated for post-COVID syndrome, and we actually did a show on one of the local news media to get the word out. So I think we can actually talk to Tina today and see how she's doing, and maybe talk a little bit about, she recommended you. All right, thank you, Tina, for joining us again. So Brooke was just telling us how she met you and how you refer her to us. Can you kind of talk a little bit about how that happened and when you went through last time we saw you a few months ago?
Sure. Um, Well, I was just, you gave me my life back. And I will forever thank you. I got my life back, and it was just amazing. So when a hospital official called me, friend, and said, I have a friend, know someone, can you help her? Can you talk to her? She's suffering from what you had, the same symptoms. I said, absolutely. Because, right then it reminded me of all the pain and months and months and months of, just laying in bed, the headaches, the brain fog, the heart palpitations, which were so scary. So when I talked to her, she was having the same symptoms. And I'm like, you have got to go see Dr. O. And I said, this is the best, and he's the healer. It was just, and I was so thankful that, she came to, as I knew she'd be in good hands, it would all.
Yeah,
Be good.
when she came here and told us you refer her, I was very pleased. And I met Brooke with her mom. She was in a bad shape. She was really depressed, very symptomatic with severe headache, palpitation. And I could feel the pain she was going through. And we had a long conversation. She quit school. She couldn't really do anything. She had to live with her mom. And, for me, anyway, it's not just about, putting you in a chamber and getting you treatment. It's almost about getting to know who you are. And making you feel like a human being, having a conversation with you, let you know that we understand what you're going through. Because most people who have post-COVID syndrome don't get that. They don't feel like people understand where they're coming from. And I'm taking care of a lot of people with post-COVID syndrome. So Tina and I have had this conversation, months ago, and with her help, we've had a lot of people calling us from all over, from Bahamas, Miami, because they saw the show on TV or YouTube. And so the more we can put this out there in the media, the more we can tell people you're not crazy.
Yes.
This is real. Post-COVID syndrome is real. Things that can be done, but you gotta seek the right help. So I'm glad I can have you two here to actually share your experiences. It's very important. So looking at you today, to me, I'm still blown away because you're smiling. You couldn't even smile the first few days I saw you.
No.
You're smiling. You're beautiful. You're glowing. It was amazing. Your mom said to me, you would not recognize her once she's better, and she's true. And you was the same.
Yes.
When I can look back and see the first time I met you two, and after your treatment, your recovery, to me, that's the most rewarding feeling I can ever have. Just to see the happiness on your faces, that you're able to go back to your routine things. So I'm really thankful that you guys show up here and we can help you. And if there's anything else you want to kind of share with the audience about, especially you, Brooke, what since you started your treatment, what happened with your symptoms? How long did it take? How are you feeling now? Can you share that story?
I could tell you today I'm feeling fantastic.
I love it. Fantastic.
Yeah. Previously, I think it took me about 5 treatments and I felt my migraines that I had for 40 days went away. The heart palpitations went away that I was having daily. Everything just started like disintegrating after the 5th treatment and the 6th treatment. I could sleep at night. Everything was just, you could just tell it was healing. And after eight treatments each day, I was back to myself again. And it was just, I forgot what it felt like to be myself. I don't know. I didn't smile.
I remember the day you drove yourself to the center.
Yeah, it's just.
And the administrator said, hey, you know what? Brooke drove herself to the center. I'm like,
I know.
really?
Yeah. Like, guys, I drove today. I couldn't. I was really dizzy. Like, every day I had this weird high feeling. I guess that's the brain fog. Yeah, it was really scary. I could easily say that was one of the lowest points in my life, physically and emotionally. And I don't know where I would be today if I hadn't have met Tina and then met you and all your wonderful employees. Yeah, I mean,
I'm kind of
can't.
curious how uh, your friends in school at work, how did they treat you during this whole post-COVID syndrome? Did they think that you were really sick? Did they treat you nicely? I mean, can you tell us a little bit about that?
As far as my friends went, supporting me, every single one of my friends has pretty much gotten COVID and healed after a couple of weeks. So when I told them I was still in bed, my third or fourth week, they were just like, "Get up, Brooke. It's time to go outside. You just have to push yourself." Nobody really understood, and nobody knew what the word long COVID meant or long haul COVID. It is not very recognized right now. And yeah, eventually, after coming here and explaining to them and sending them papers and research on long COVID, they finally got to understand it a little. But
It must have been very frustrating during that process.
it
Right? Nobody
was,
really
yeah.
believed or understand what you were trying to tell them.
Yeah, my family too. I mean, kind of my mom was just really on my side with seeing me every day and taking care of me, knowing what was going on exactly. It was emotionally bringing her down, and yeah.
How about you,
That-
Tina? What did you?
That's why I reached out, when he put us in touch, and I knew the emotional journey she would be going through, and so I sort of, told her about the emotional journey, because that's the problem. Is people, still to this day, when I said something to someone recently, they never heard of long COVID. And so it just shows me that people aren't really educated about it, or know about it. It's not out there enough. And maybe there's a lot of people out there that are not well and they're not getting any help that they should, because it's not out there enough. So the emotional journey was tough. I knew she was, so I had gone through that myself, and I was able to share my emotional journey about people, sort of, oh, the same thing. There's nothing worse than somebody saying, "Oh, get out of bed," or trying to push you, when you absolutely are physically gone. There's nothing worse than somebody doing that, and and you couldn't get out of bed, and your physical health is gone.
Yeah. And there's a lot of anxiety and depression. I can
Oh,
imagine.
yeah.
Absolutely.
And I've seen people where they just keep prescribing antidepressants and not really addressing the issue. So I'm hoping this show that we're doing will really enlighten people and educate people on the knowledge about post-COVID syndrome. This is a real syndrome. Brooke, it's interesting that you're 23 years of age. And for months, I can hear young people saying, COVID is not a big deal. It won't happen to me. And can you share with the audience what your take is on that this could happen to these young people, like yourself? And did you ever hear about hyperbaric oxygen prior to this? Can you tell us a little bit more about that?
Yeah, I personally thought for a long time COVID was not a big deal. And especially for somebody my age, I did not think I would be affected the way I was. And it is not widely known at all in my age range or spoken about with people who have long COVID. And I definitely think that it's important. I'm hearing about it more often now that I know the definition. And it's just important to know that it can happen to anybody. I don't know.
And what was it like to be in an hyperbaric oxygen chamber?
Yeah. The first time, I've never seen it or done it before, so it was a little scary, but then I completely got used to it. I got comfortable, fell asleep in there a few times. It was great. Yeah, I liked it. It was a moment to relax and just kind of get rejuvenated.
Yeah, the chamber is not as scary as people think.
Mm-mm.
The one we have here at the center is clear glass. It takes about 90 minutes in the chamber. You get to pick a movie in Netflix and you watch, or you just can relax. And you can talk to your tech while you're in there. So, I mean, Tina, Brooke, you both went through it.
That's
and,
the best feeling, you know, it's the clear, you know, that's what I wanted because of my claustrophobia, and I was so thankful. You had the clear, and the other thing is, like you were singing, talking, you got the tech sitting right there with you the whole time. So it's a very safe feeling. This, you know, it's a true, like I said, a true medical spa. And here, you know, just not a spa you go to, you know, this is a healing place. And it healed my entire life.
Thank you.
For you, I'll be forever grateful. And I'm alive because of you.
Thank you. Thank you, Tina. Thank you, Brooke. Again, fantastic wellness center. The goal of the center is to treat you as a human being. Really take into account everything about you. We offer hyperbaric oxygen treatment here. The other things we do here, we do IV vitamin infusion, we do PRP treatment, we do facial, microneedling, warm sculpture, weight management, hormone therapy replacement, anything that you think you may need. It's all about wellness, about keeping healthy, staying healthy, living longer. You know, if you don't have it, chances that we'll be having it soon. So if you need anything, any questions, just reach out to us by phone or by email. Again, thank you for watching.